Welcome to Science Era. In this video, we're going to discuss pharmacology. So, Unit 1, Introduction to Pharmacology. Before we know what is pharmacology, we need to define drug. A drug is a chemical substance which can be natural or synthetic, which when given to a living organism produces a biological effect. So, drug equals chemical substance equal biological effect. Pharmacology is the science that deals with drug action. What type of effect does drug have on the living body? It includes the study of chemical properties of drug, physiological and behavior effects of drug on living organism, mechanism of action of drug, how drugs are biologically transformed in living organism, and the therapeutic and non-therapeutic uses of drugs. History of pharmacology. In the earliest phases of drug use, noxious plant and animal preparations were administered to a sick person to get rid of the body of the evil spirit believed to cause the illness. Pharmacon is the word which from the term pharmacology is derived. Originally, it means a magic charm for treating disease. In the second phase of drug use, generation of folk knowledge enabled people to correlate natural substance with treatment of diseases or symptoms. The therapeutic value of natural product were found through the trial and error method. The goal of pharmacology is to understand the mechanism by which drug interact with biological system to enable the rational use of effective agent in diagnosis and treatment of disease. Like any other area, pharmacology also have branches. The first branch of pharmacology is pharmacokinetics. This is the branch that deals with route of administration and absorption, distribution, biotransformation, excretion, and storage of drug. Pharmacodynamics deal with action of drug, that is the physiological or biochemical changes brought about by drugs, and deal with their mechanism of action. Then therapeutic is the branch which is concerned with treatment of disease. Various types of therapies are applied like physiotherapy, psychotherapy or radiotherapy. Pharmacotherapeutics is the branch of therapeutics that deal with the use of drug for treatment of disease. Other branches include toxicology, which is the discipline that deals with diagnosis, treatment, and prevention of toxic effects of drug and drug poisoning. Pharmacy is the branch of pharmacology that covers the art of preparing and dispensing drug. Experimental pharmacology is the branch of pharmacology that deals with effect of drug in animal, human volunteers and the living tissue. Then we have clinical pharmacology, which deals with the uses of drug in patients, like measuring the blood levels of the drug has important role in determining the dosage regime and the use of drug in patient and in individual. It also includes the study of toxic or undesirable effect in patient and application of drug in treatment of disease. This field is now gaining the lot of importance. Subdivision of pharmacology, as we said before, there are two main subdivisions: pharmacokinetics and pharmacodynamics. Pharmacokinetics have four sub branches: absorption, distribution, metabolism, and excretion. And pharmacodynamics, we deal with receptor binding, signal transduction, pharmacological effects, and dose response. Then we have drug. Sources of drugs. A drug is a chemical substance, as we said, that when given to a living organism, it will produce a biological change. Drug may be obtained from natural source. They can be synthetic chemical or produced through a genetic engineering. So let's look at natural sources first. Natural source of drug includes substances that have been acquired from plant, microorganism, animals, fungi, and minerals. Morphine, cocaine, atropine, quinine are all kind of alkaloids derived from the plants. Antibiotics are typically isolated from bacteria or fungi, and hormones, for example heparin, are often obtained from the animal tissue. Few minerals are useful therapeutically, although lithium is well known as the treatment for bipolar disorder. So these are all the example of drugs obtained from the natural sources. Then we have synthetically made drugs. Many drugs are synthetically made and are products that have been modified from the natural sources. For example, aspirin, barbiturate, and alcohol anesthetics were the first drugs to be chemically synthesized. Then we have genetically engineered drug. Many genetically engineered drugs have been developed and approved for the treatment of a variety of diseases and are produced using recombinant DNA technology. They include hormones, enzyme, growth factor, coagulation factors, and antibodies and vaccine. A medicine is a pharmaceutical preparation that contains one or more drugs intended to generate a therapeutic effect. Medicine usually contain other substances that make them more convenient to use. Let's look at the example of pharmaceutical preparation. In this case, we are going to use the opium poppy. So opium poppy, the plant is the natural drug source. The crude drug preparation will be the raw opium. Pure drug extract will be morphine sulfate, which is extracted from the opium plant, and the pharmaceutical preparation when we modify morphine sulfate into tablets or liquid or any other form. In this example, we have modified into the morphine tablets. Pharmaceutical preparations are the drug product that are suitable to administer to a patient. Drugs that are taken orally are typically in tablet or capsule form, although they may also be in solution and suspension, especially if they are to be taken by the children who cannot swallow tablets. Tablets and capsules can be formulated either to release the direct drug directly after ingestion or to release the drug over a period of time, in which case they are called sustained release product. Solutions and suspensions are the most common liquid pharmaceutical preparation. They can either be taken orally or administered parenterally from from injection and infusion. Skin patches can also be used to administrate drugs, in which case the drug is absorbed through the skin. Aerosols, ointments, cream, lotions, and suppositories are other type of pharmaceutical preparation that can be used to deliver drugs. Route of drug administration. The route of drug administration includes internal administration, parenteral administration, transdermal administration, inhalations, and topical administration. The internal administration include all methods where the drug is absorbed from the GIT. This incorporates sublingual, buccal, oral, and rectal mean. Then parenteral administration include all methods of drug administration that require a needle and syringe or intravenous infusion pump. The most frequently used parenteral routes are intravenous, intramuscular, and subcutaneous route. Transdermal administration involves placing either a skin patch or ointment on the skin. The drugs are then absorbed into circulation through the skin. Lastly, we have inhalation administration involves breathing in a drug. Inhaled medication are typically absorbed quickly and can act both locally and systematically depending on the drug involved. Four main types of or four common route of drug administration and their advantages and disadvantages are: number one, oral route. Advantages include it is convenient, relatively safe and economical. Disadvantage cannot be used for drug inactivated by gastric acid, for drug with a large first pass effect, for the drug that irritate the gut. So we cannot use it for drugs that irritate gut and passes the first pass effect. Second route is intramuscular. Suitable for suspension and oily vehicles, absorption is rapid from solution and is slow and sustained from suspension. Disadvantages include it can be painful, can cause bleeding if the patient is receiving an anticoagulant. Subcutaneous, suitable for suspension and palace. Absorption is similar to that in intramuscular route and but is usually somewhat slower. It cannot be used for drugs that irritate cutaneous tissues or for the drug that must be given in large volume. Then we have intravenous, which bypasses the absorption to give an immediate effect, allows for the rapid titration of drug, achieves 100% bioavailability. Disadvantage of intravenous route of drug administration include it poses more risk for toxicity and tends to be more expensive than the other routes. This brings us to the end of introduction to pharmacology. Thank you for watching. If you like my video, don't forget to subscribe for more.